here, but I do want to bring in Tom, who's with us now. We've reestablished contact with him. Tom Saving, thanks so much for being with us.
Great to be with you.
All right, we've got only a couple of minutes here, but real quickly, unpack some of the new information we're getting on this healthcare report and on Obamacare spending. We're going to likely see a big increase in spending on this front next year. Is that right?
There's no doubt about that. We're going to see a big increase in spending. The whole idea of Obamacare, as you want to call it, that is to increase demand for health care and somehow control total health care expenditures by using price controls. And those two things are just don't go together, and they're not going to happen. So we're going to have a huge increase in demand, and we're going to have to come to grips with how we're going to deal with that increase in demand on the supply side. And it's not going to happen if the things in Obamacare, that is the productivity adjustments and other things that are in the bill, really happen.
Now, do you think we can? Do you think we can expect to see healthcare spending outpace other spending in spite of the ACA?
Oh, I don't think there's any doubt about it. The industry thinks that they're adding employment faster than any other industry in the country. And the second thing that's happening, if you look at stock market performance, the investors think that this is going to happen. Everyone thinks that this is going to be the boon to healthcare that the hospitals and the doctors who supported the bill thought it was going to be. I don't think there's any doubt about it. That the industry's expanding like crazy. They're expecting a boom, and they're not expecting a boom to make less profits. They're expecting a boom to make more profits. And that's where they're headed.
With about 20 seconds left to go, the question remains, who is going to pay for all those folks who these hospitals and medical companies are hiring?
Well, they're going to have to be paid. As I tell people, the Congress is not going to let the health care shelves be empty. So they're going to have to rescind all of the productivity adjustments, just as they've always rescinded the sustainable growth rate adjustments on physician payments.
All right, Tom Saving, we'll have to cut it off there. Sorry for the short interview, but we got to go. Hard break here. Tom Saving, thanks so much for being with us.